Welcome to Lyme Time. I'm Ali from the Tick Chicks. We are all more than Lyme disease and chronic illness, and together we stand with you to overcome and rise. I'll bring you closer to the experts in cutting-edge treatments and even a few unexpected ways of healing. I'll ask the questions you want answers to regarding Lyme disease and successful ways of getting you closer to 100%. We are in this together and will not be defined by Lyme. Today's guest is Dr. Rana Mafee. Dr. Mafee is the chief neurologist at Case Integrative Health, working with Dr. Kelly to treat complex neurological disorders, including tick-borne disease, daily. Dr. Mafee is a former assistant clinical professor in neurology at University of Illinois. Essentially, she's a Lyme-literate neurologist. Dr. Mafee is truly an amazing human, working with complex patients to solve symptoms and improve their lives. She has studied the causes, effects, and treatments of neurological disease extensively and lectures nationally on this and other topics. Dr. Mafee received her education at the University of Iowa, the University of Illinois, and UCLA. Dr. Mafee is on the American Board of Integrative and Holistic Medicine, the Academy of Integrative Health and Medicine, the American Academy of Medical Acupuncture, the American College of Nutrition, and the American Headache Society Institute for Functional Medicine. Welcome to Lyme Time, Dr. Mafee. And as you know, my listeners struggle with Lyme disease and other various types of chronic illness that just sort of come with that umbrella of Lyme disease. As you know, there are many symptoms of Lyme which vary from person to person, some of them neurological and some not. Can you tell us what defines neurological Lyme?
Well, I'll start out by saying that as a traditionally trained neurologist, I saw very little Lyme in my practice. As you know, as a Western trained neurologist, we were always taught that, to check Lyme disease, if somebody presents with something like multiple sclerosis or Bell's palsy or other kinds of acute neurological presentations. However, as you and a lot of your audience members know, Lyme disease is very difficult to diagnose and is a controversial topic among more traditionally trained physicians, particularly neurologists. So for me, I really gained more of an understanding of Lyme disease and neurological manifestations of Lyme disease kind of after I started expanding my paradigm and the lens from which I was kind of approaching patients with, particularly using functional and integrative medicine. And I could tell you that from my clinical experience that I have seen patients with either a history of Lyme disease or happen to get a diagnosis of Lyme disease with all kinds of neurological conditions and diagnoses. So ranging from central nervous system issues in the brain and spinal cord to peripheral nervous system issues in the nerves and muscles. So to get back to, now I'm being circular here, but to get back to your question of what defines neurological Lyme, Lyme has a predisposition to attack nervous system tissue, nerves and brain tissue. So really, the symptoms and presentations can really kind of span a wide range. So patients can present, similarly to an acute MS exacerbation, which has a wide variety of symptoms, whether that's based in brain disease or spinal cord disease. They can have more peripheral nervous system symptoms. They can have, an attack of a single nerve, like, for example, the facial nerve, like Bell's palsy, or other kind of cranial nerves. We have 12 cranial nerves, that we can get more into, but, you can have acute attacks of those cranial nerves. I've seen patients with neurodegenerative conditions like Parkinson's disease and Alzheimer's disease and other dementias that have either had a history of Lyme disease clinically or by, labs, or have just through workup, we happen to find it, as part of a piece of the puzzle. So it's not necessarily the cause of their Parkinson's disease or their Alzheimer's disease, but it certainly seems to be a player. So, as you and your listeners know, that Lyme disease tends to present either musculoskeletal or, neurological, or some people have both. And, the neurological, Lyme patients tend to be a little more difficult to treat.
Okay. It's so fascinating. You mention single nerves, and sometimes I just find that those symptoms are the hardest to calm down once they're activated like that. Would you consider tinnitus as part of that, or is that is that not considered neurological?
Tinnitus certainly is considered neurological. Oftentimes people can have tinnitus from, and it can go along with other things like hearing loss, vertigo, because oftentimes it manifests in a dysfunction of the eighth cranial nerve, which controls hearing and balance. So certainly tinnitus is certainly considered a neurological symptom. Yes.
And what about trigeminal neuralgia? Is that ever a symptom of the Lyme disease?
So again, stemming from my traditional training, it was not something that we were taught to look for trigeminal neuralgia. For Lyme, for Bell's palsy, it was something that we would oftentimes check and usually never find through traditional testing. But trigeminal neuralgia is not traditionally taught as, to think in the differential, think of Lyme in the differential. However, as I said, just through my clinical experience over the last, several years after having changed my paradigm, I think that there definitely is a possibility that patients suffering with trigeminal neuralgia, there may be, not every case, but there may be a possibility that, Lyme or tick-borne illness might be a cause or a player.
And I know that you made the transition from traditional medicine over to the functional medicine realm, and so and you just said that you're seeing more connection between neurological issues and actually expanding your lens in accepting that, hey, maybe everything that I was taught in school isn't so cut and dry. And I experienced this with my own neurologist. I mean, I basically had to beg for a Lyme disease test. So now that you're in the integrative and functional medicine category, so to speak, are you seeing an increase in your Lyme disease patients over the years, or would you say that that's just a matter of you practicing in functional medicine now, in integrative medicine?
Well, number one, I certainly am seeing quite a bit more of it because I'm looking for it more, and I'm looking for it in ways, using other not so traditional tests that I wouldn't have used in the past. So, I think definitely based just, given the nature of the way that I practice now, I think for sure I'm seeing more of it.
And what would you suggest if I came to you as a new Lyme patient and I was exhibiting signs of Lyme disease? What types of tests would you perform on me to confirm the Lyme?
Well, number one, it kind of depends individually on what your presentation is, what your symptoms are. But if you're just focusing on the Lyme, I always start with, traditional Western blot testing through standard labs. And I'm always really delighted when I find the answer there, because
Sure.
then I don't have to move on to other more specialized tests. Because as you know, they can be very costly, and they are also controversial and not as well accepted by even infectious disease doctors. So if I find it through traditional, Western blot testing, then, like I said, I'm delighted, and I get a good start there. However, I've learned over the years that with Lyme can come some co-infections as well. So rarely do I just stop there. So I may offer patients more specialized testing, um, to look for different strains of Lyme. If the Lyme testing was negative, through traditional testing, and I really highly suspect it based on their clinical presentation, it's another reason to kind of go for these, more expanded tests. So, yeah, so I've been using a lot more of these, um, not so traditional tests.
Got it. And so, um, for everyone out there who doesn't want to waste a lot of money and time, you would suggest possibly just starting out with the Western blot, and then from there, if we're still not satisfied, then moving on to more of an IGENX type test.
Yes, so IGENX is kind of considered one of the gold standard labs for, looking at expanded Lyme and co-infection testing. Can be quite costly for patients.
Yeah, I think my last one was $2,300.
It is.
But we tested for a lot of co-infections, and as you know, they're discovering more and more and more strains of bacteria as we speak. So I think it is important. I'm constantly in areas where maybe Lyme disease isn't prevalent, but other tick-borne illnesses are. So
Sure.
that's why I did that. But I'm praying for a day, doctor, that those tests are just one of the few that you immediately can give somebody when they come in with neurological symptoms. And when I say you, I mean the traditional Western medical world.
Right.
um, so what are some of the most effective forms of treatment for neurological Lyme? And I know that we have to speak in generalities here, but what do you find that can be most helpful for neurological Lyme?
Well, Lyme in general, it's not all about killing the bug. It's about kind of taking care of the kind of a disruption in immune status that it causes, and clearing out toxins that they leave in their wake. So rebalancing the immune system, as well as, targeting, eradicating, the pathogens are kind of the goal. So, for the first part, for eradicating the pathogens, antibiotics are often used. I often use antibiotics, usually a combination of antibiotics, because of the different the different stages in the life cycle of Lyme. So oftentimes it's, three antibiotics, oral antibiotics. I have not been in the practice of using IV antibiotics, but some people have been using IV antibiotics, especially for things like neurological Lyme.
Mhm.
Um, and also certain, not as accepted by the traditional medical world, but as an alternative to antibiotics for those who don't tolerate or don't do as well. There are different, herb combinations that are offered to patients, with either musculoskeletal or neurological Lyme. And then, um, there are other forms of, treatments that are geared towards, treating, the kind of the eradication aspect, as well as the immune rebalancing and sort of the detox aspect, improving detoxification. So certain forms of IV therapies that we offer in our practice, some Lyme literate doctors will use IV ozone, things like IV NAD, nicotinamide adenine dinucleotide.
That's what
And
I do, by the way. I really love that one.
Mhm.
Um, and it's interesting. So you said you might combine up to 3 antibiotics. Would that be at one time simultaneously, or do you rotate them?
It's typically simultaneously. Some of the antibiotics are pulsed because of certain stages of the life cycle of Lyme, like the cyst form, are very, very stubborn and difficult to treat and can evade treatment. So by pulsing treatments, treating for a few days and then taking a break and treating for a few days. So some of the antibiotics are continuous, some are pulsed. And in terms of length of treatment, it can vary from patient to patient. If somebody has neurological Lyme and it's, manifesting in terms of a neurodegenerative condition, typically treatments tend to be longer because those are harder things to treat. The earlier you catch something like Lyme or other tick-borne infections, better off, and the shorter the treatment, more likely the shorter the treatment.
And what would you say would be your comfort zone in terms of a maximum duration of antibiotic treatment before you just went ahead and took the patient off antibiotics and focused more on holistic type treatments?
Um, well, I don't know that I've ever had in my mind a cutoff like that. And being on antibiotics for a long period of time is a very challenging treatment on the body. Like
Yeah.
you are disrupting your microbiome, which we've discovered, in the last several decades, how important the microbiome is. So a lot of things you have to take into account there. But like I said, it's very individual. And if somebody is doing very, very well with antibiotics and once you stop them, seems to be taking a step back, I'm not going to just stop because I have a cutoff in my mind. So it's very variable from patient to patient. And
Yeah. I'm kind of asking because there are patients out there that have been on for years
Mhm.
and frustrated or not really sure if they're experiencing symptoms of the Herxheimer reaction or just actually, continuing to feel the effects of the disease. And I really feel for those patients. And I'm not sure if there is so to speak, a cutoff, a point in which some doctors who are Lyme literate would then just remove the patient off antibiotics. And I know it varies from patient to patient, but I mean, when I hear years, I'm wondering your thoughts on that.
Yeah, that there is a little bit of a discomfort there. So I have not yet had a patient myself that I've had on antibiotics for years and years. So I would try to, shy away from continuing on for years
Right.
and years. And reaching for some of these other alternatives, like the IV therapies or peptide therapies
Mm.
or, continuing herbs, which are, also antimicrobial and do have some, untoward effects on the microbiome. But in my mind, they're a little gentler than antibiotics. So.
Yes, yes. And then I was speaking with somebody who was asking me some questions the other day, and they are concurrently on 9 antibiotics. And
Wow.
I said, I'm going to have to ask an expert about that if that's unusual or not.
That's a bit unusual in my opinion, but
Yeah, because I get concerned that if you're sort of throwing so much to try to kill the bug, so to speak, you're really just bringing on a whole other host of symptoms that I always tell people, just try to be patient, take one thing at a time. So you can know, and I mean, one thing at a time could be up to 3 antibiotics or 4, but it does concern me that they're experiencing some reaction from such an overload of antibiotics that perhaps it's surpassing the symptoms of the Lyme disease itself.
Yeah, I would agree with you on that. I think at a certain point, you do have to kind of reevaluate if you're getting to that point of being on that many antibiotics, and kind of considering your other options, definitely.
I think that's where the line is between the traditional Western way of thinking and then the integrative way of thinking, is that, just Western tends to focus on killing this bacteria. And so many people, and I included in the beginning of my journey, I was just wanting to get this thing out of my body and kill it. And then I could somehow move on with my life. And then eventually I just came around to more integrative practices so that I could just live with Lyme disease. And actually that's exactly the point when I came into remission, because I was able to stop the madness of trying to kill the bug.
Sure.
And on that note, a lot of people want to know, am I stuck with this for the rest of my life? Has anybody truly cured or found a cure or been healed 1,000% to where there's no longer are they reading Lyme disease or the strains in their blood work? Is that an unrealistic expectation, or what should our expectations be with neurological Lyme?
That's a good question. I don't have the best scientific answer for it, unfortunately. But I can tell you that, most certainly if patients are treated appropriately with, therapies that, eradicate the Lyme, as well as therapies that focus on rebalancing your immune status and improving your detoxification, which are really important over time, that for sure people can go into remission. There's no question about that. As I said, the neurological manifestations are harder to treat, and the further down you are. So if somebody has pretty advanced Parkinson's disease, there's already been a lot of damage there. So we may really get the Lyme under control and eradicate that, but they're left still with, significant dysfunction because of degeneration over time.
I see. And would their blood work actually reflect 0 levels of Lyme? Because I've heard different things. I've heard some doctors say, look, once you've had Lyme in your system, your numbers will kind of always read that there's some level of Lyme bacteria in even if you've healed.
Right. So I've never had yet a case where patients' labs are completely like clean. Yeah. So I've never had that. So oftentimes, when your Western blot, shows things that are positive, just because they remain positive doesn't necessarily mean that you still have active Lyme. So I don't know if that answers your question completely,
Yeah,
but
I think it's helpful to know the truth about that. That you can be feeling good and go in for blood work, and there it is again. And I think psychologically we need to understand that it may always read in your body. It may be sort of a dormant type situation, but you can consider yourself healed from it, or at least in remission, if nothing else. So that helps me a lot. And I think that'll help a lot of people out there that are fixated on the numbers.
Mm-hmm.
And does neurological Lyme always invade the brain, or can you have, yeah, I guess that's what I'm asking. Does it always involve the brain? Is there ever a case where you can have neurological symptoms, but it hasn't gotten to the brain yet or affected the brain?
Um, again, I can't speak on what's published in the literature on that, but
Mhm.
uh, from my clinical experience, most oftentimes if people have neurological Lyme, there is some brain involvement more often than not. That you can have peripheral manifestations of Lyme, with neuropathy and things like that. Uh, so I personally, I would say from my experience, that the majority of my patients that have Lyme with a neurological diagnosis condition, most of them have had more central nervous system sorts of issues, so brain and spinal cord and things like that.
And can some people develop neurological Lyme immediately after a vector bite, or is it something that the longer the bacteria sits, the more likely you are down the line to develop neurological Lyme?
So you can it certainly can cause acute symptoms. If you have a recent exposure to Lyme, it can definitely cause acute symptoms, but the longer you've had it and not known about it, the more opportunity and chance it has to embed itself in nervous tissue. So yeah.
And can a subsequent bite trigger neurological symptoms, even if it doesn't, even if that bite doesn't contain the bacteria, the same bacteria you had the first time? In other words, if I got bit a subsequent time by a different tick, obviously, um, and it triggers neurological symptoms, is that fairly common?
Uh, it's very conceivable for sure that, if you have already been diagnosed with Lyme, dealt with Lyme, and then get bit by a tick with Lyme again, perhaps a different strain, that for sure it could instigate, kind of more symptomatology for sure.
Yeah, I think there are a lot of people that are outdoorsy and that's their lifestyle. And of course, those are people that are affected by Lyme disease. They're very active people and they're constantly in conditions um, where they might be exposed again to tick-borne illness. And I want to go back a little bit and discuss Bell's palsy, because this seems to be one of the symptoms that seems to be relatively common. I'm saying relatively, but it is not, it's a I'm going to have to edit this part. But Bell's palsy tends to be a somewhat of a common symptom, maybe not highly occurring, but it is a symptom. And I'm often asked about Bell's palsy treatment and can it be reversed? What are your thoughts about the Bell's palsy?
So, for your listeners that aren't as familiar with Bell's palsy is basically like an acute inflammation of one of your cranial nerves, the seventh cranial nerve that mainly controls facial movement. There are some other functions, like it partially controls part of your taste. It does kind of provide some input to hearing as well. So when somebody presents with Bell's palsy, they'll typically have acute paralysis of one side of their face. Very rarely will it affect both sides at the same time, but you'll have, a drooping of your mouth and an inability to completely close the eye on that side. So typical presentations are, like I said, acute. So they come out of nowhere. You might wake up with it or something like that. Most often time, Bell's palsy gets better and you regain function of that, of the nerve, with some exceptions. Some people are left with some residual weakness or some misfiring of nerves, where something called synkinesis happens, where when you try to smile, you actually end up closing your eye on that side. You can have vision issues because you're unable to close the eye. So you can, because of that, there's a risk of losing vision on that side. So typically people get better over, I would say, a month or so. Oftentimes people are treated with a course of steroids, like oral prednisone, because of the nature of it being an inflammation. There's something causing inflammation. And, in my traditional training, we're taught that viruses can cause it. So a lot of the herpes family of viruses, so herpes simplex or Epstein-Barr virus or cytomegalovirus or the virus that causes chickenpox can be underneath it. However, Lyme is always something that we were taught to check for. And as I said before, typically we would usually not find it through traditional testing. It's usually a self-remitting thing. Oftentimes patients are given steroids with it. Sometimes they're given an antiviral as well because of the possibility of a virus being at play, like a herpes virus. And I might have forgotten your exact original question about Bell's palsy.
Well, I wanted to, there are people out there that's their main symptom. I mean, that's the thing that concerns them the most because it is visible. And so they're wondering, and I'm sure that their doctors put them on the steroids or a possible antiviral, but I'm wondering if is this something that can be helped with acupuncture or anything else, or is it mostly just a waiting game and to be on these medications until it subsides?
It's most often a waiting game. More often than not, steroids are on board for maybe a week or two. And acupuncture for sure can possibly be considered. It might be beneficial for some. So as an adjunct to those other things. And, if somebody does obviously get diagnosed with Lyme disease at the same time as a diagnosis of Bell's palsy, then we would pursue treating Lyme disease as well.
And so I want to also go back to some other related neurological conditions. And I know that in people that have passed away with Alzheimer's and dementia, they're finding spirochetes related to Lyme. And I've heard that there are some preventative therapies that can exercise the brain to prevent Alzheimer's and dementia. So I'm just curious to know, do you believe that Lyme disease is an active cause of Alzheimer's and dementia? And is there anything that people could do with Lyme disease to be a preventative measure to stop it progressing to that level?
So I'm currently training with Dr. Dale Bredesen and his RECODE protocol. So he's a neurologist who's dedicated his life to research in aging and dementia. And his RECODE protocol is it's basically a functional medicine approach to treating Alzheimer's and dementia in general. And I can tell you that there is evidence in the literature, as you alluded to, of autopsied brains of Alzheimer's patients showing these spirochetes, showing these bacteria, showing Lyme disease. The way that the training is structured through Dr. Bredesen's protocol is he teaches that there are actually 36 different potential causes that contribute to dementia. So, and then he further breaks it down to 6 subtypes of dementia. And one of the subtypes is actually what he calls toxic dementia. And under that umbrella would be included things like Lyme or other tick-borne infections and mold, and things like that. So some patients with dementia certainly may have something like Lyme or other tick-borne infections as a contributor for dementia. I wouldn't go so far out to say that Lyme is the cause of their dementia, but it certainly is a player in some patients with dementia. So if somebody has had a history of Bell's palsy or some other, thing that tipped off a diagnosis of Lyme disease, I think it is very important to try to adequately address it and treat it, because down the line, this can be something that fuels the fire for things like Alzheimer's disease.
Interesting. Yep. I find it interesting that a lot of these diseases that we're discussing, Alzheimer's, um, dementia, MS, lupus, even, there are such a high percentage of people with Lyme disease that also have those. S-
Mhm.
And we're not saying it's Lyme is the cause of anything. I just feel like, we never know what the beginning and the middle and the end is for any of these diseases. But I was told once by a physician that, um, you know, you've got to take control of your health right now. I was in a hugely acute state, and and things were becoming layered on and on and on. And and I was told, you don't want this to develop into an MS or lupus. And I never considered once that this could keep going into into worse and worse and worse conditions. And that was like a real awakening for me. And do you concur with that philosophy that these other conditions can develop as a hand in hand with Lyme?
Certainly, yes. So, as the bacteria embeds into your nervous tissue, if nothing's done about it, then it's causing a lot of disruption, actual killing of neurons, disrupting synapse connections between the neurons, releasing toxins that are toxic to the neurons. So for sure, the longer it's there and unaddressed and untreated, there is a possibility of, getting to one of these diagnoses.
hmm And in addition to, we discussed treatments like NAD and peptides and things like that. Do you also prescribe, um, and herbs, of course? Do you also prescribe supplements on top of that? People have questions about supplements all the time. I
Mhm.
personally take them. I'll probably take them the rest of my life just as a preventative. But what are your thoughts about supplements?
Yes. So, as a general rule, I would say, I don't only see Lyme, I see other neurological conditions. And because I practice functional medicine, I also see general functional medicine as well. And rarely do I have a patient where I say, I don't even have one supplement to recommend for you. So for sure, I think supplements do have a place. They are supplemental. They are kind of like a window dressing. So the foundation really is, diet, mitigate stress properly, sleep enough, get enough movement and exercise. Those really are the foundations. But supplements for sure have a place. I can tell you, I take, a number of supplements myself, as a baseline. As I kind of said, rarely do I ever say you don't need a supplement. I'm almost always recommending fish oil and vitamin D at the least for
hmm
patients.
hmm
So yeah, I think supplements have a huge place. But as the supplement industry is very unregulated, and so patients have to be very careful with products that they're choosing. And if it's best to work with a provider who's really um, savvy and knows, what what companies are vetted and what products are vetted.
I agree with that. Don't go rushing out to buy them off the internet. Just take your advice of your doctor.
Right.
Um, but that's great. And what would you say is on the horizon for treating neurological conditions in the future? What can we look forward to? Is there anything that excites you about possible ways to treat Lyme disease in the future?
So I would say primarily what excites me the most is just through this training that I've been doing through Dr. Bredesen and his Recode protocol. Um, you know, there's a lot of good data that protocols like this really, really work, and that you can prevent and reverse things like cognitive decline. And I think you can carry that over into other sorts of progressive neurological conditions. So, for example, if somebody has a strong family history of Parkinson's disease or MS and wants to really take control of their health and be preventative, I'm a big, um, proponent of what I call preventative neurology. So, really getting at it and optimizing things so that you don't end up down that road. Because once you do progress further and further as a Parkinson's patient or an ALS patient or an Alzheimer's patient, the harder it is to treat these things for sure. Of course, there's always, Western medical treatments, pharmaceuticals that are in the pipeline for these things as well, which can be exciting as well. They've developed a lot more treatments for MS over the last decade. So that's exciting. But I would say for me, what excites me the most is, this aspect of prevention and preventative neurology.
And what does that look like? I mean, can you give us a couple of specific examples of preventing cognitive disabilities?
Yeah. So, one kind of topic that I'm excited about is something that Dr. Bredesen calls, which is cognoscopy.
Hmm,
He coined that term. It's kind of,
nice.
instead of your colonoscopy, in addition to your colonoscopy, you get your cognoscopy. So this is, he recommends that everybody over the age of 40 do a cognoscopy, which is essentially breaks down to um, doing kind of as a functional doctor knows, doing a wide range of lab assessments to look at metabolic status, inflammation markers, nutrients, hormones, things like that. Um, so that's one aspect. And then another aspect is actually doing cognitive assessments. So doing, quick, maybe 15-minute, in the clinic sort of cognitive assessments on patients, or, even more extensive cognitive assessments if they're necessary. And then obviously a neurological exam as well. And if patients' labs look great and their cognitive assessments look great, then they're probably good to go. But if there are red flags and there are things that are, like highlighted, meaning, if you're showing signs of inflammation, or you're showing signs of insulin resistance or metabolic imbalance and things like that, that really needs to get addressed, because those are huge, huge things that drive things like cognitive decline and dementia.
Sure.
And
And then if you saw signs of that, what would be good for us out here, even just staying on top of our cognitive health? Are there any at-home treatments or anything you could recommend that would be helpful to prevention?
so, as I was alluding to before, the lifestyle piece is so foundational. So, diet is huge. So, if anybody is showing signs of cognitive decline, like mild cognitive impairment or early Alzheimer's, um, the diet is really, really key. And because of how insulin resistance plays a role, and sugar in general can be very toxic, the kind of the foundations of the diet are kind of aligned with more of a ketogenic diet approach. So a very high fat, high, non-starchy vegetable, good quality protein diet with very minimal carbs can really, patients can get a lot of mileage just out of that. A lot of patients report a lot of mental clarity when they initiate on a keto diet.
Oh, yeah. Energy.
They're not the easiest of diets to follow, but if you are, heading towards dementia or mild cognitive decline, it's a serious thing to consider. And, these diets are huge changes in your lifestyle, but they can make a huge difference too. So diet is important. And also managing stress and getting enough sleep and making sure you're sleeping, your sleep quality is good, making sure you're getting enough oxygen when you sleep. So these things are also possibly assessed during a cognoscopy. Um, and exercise. Exercise has so much research in terms of how it increases what's called brain-derived neurotrophic factor, which is like fertilizer for your brain, which enhances neuroplasticity and neurogenesis, make the formation of new neurons and connections. So the very, very important to get enough exercise, because you really, really are doing your brain a favor when you exercise. And then things like brain training. So exercising your brain. So stimulating your brain. So whether it's ongoing learning, whether it's, taking or auditing a course or learning a new language or learning an instrument or doing, online, things that are an online platform that are intended for brain training. So brain games, things like that. One of the ones that's kind of promoted by Dr. Bredesen is what's called Brain HQ by Posit Science. So they've got the most data. They've done a lot of research and shown that, brain training really works. So, there are other copycats, like Luminosity and things like that. But Brain HQ has the most data behind it.
Well, that's exciting. It's an exciting field to be in. I think, especially with what's going on now currently and in the pandemic. And I just feel like we're going to learn a lot through that research.
Mhm.
And I personally feel that even though Lyme disease is not a virus, it acts as though once it's in your body, it acts as though it's a virus because it can go to multiple tissues and muscles and bones and just kind of wreak havoc all over your body. So it doesn't really act, in my opinion, like much of a bacteria at all. It just gets in there too deep. So, I think that this is all so exciting and we have a lot to hopefully look forward to and raise awareness to get the funding and the money toward going to some preventative measures in the future. Are there any last thoughts that you have for our listeners who might be really, really struggling right now? They might be in areas where they aren't able to get to Lyme literate doctors easily, or and they're just dealing with neurological issues. I in one part of my journey, I did experience some dementia type experiences that would come and go in waves. It didn't stick with me, but I mean, I would be in a place like a grocery store and not remember why. I knew where I was, but I didn't quite understand why I was there, that type of a moment. And it was really, really scary. And as you know, so many people are undiagnosed or misdiagnosed, I should say, for years. So what can you offer as last thoughts for those people out there?
Yeah, well, I have to say that there have been some silver linings with the pandemic and with COVID, and I've been able to connect with patients from all over the country because patients have been able to find me and they've been able to visit with me through, virtual visiting. So I think, the fact that we can do that, I think it's opened up, integrative and functional medicine in general to a lot of people. So I would just encourage people to not lose hope and to, continue working with whoever their providers are, that they're working with, in their, current location, to kind of work with them and to hopefully get them to somehow meet eye to eye. And if not, then, I think meeting with somebody virtually, I think is a great alternative, is a great option.
I think it is too. And where can they find you for telemedicine?
So I am currently working at Case Integrative Health in Chicago. So it's caseintegrativehealth.com. You can find information on the website about, how to contact us. And we have, other information. I work with Dr. Casey Kelly, who is, known internationally as a Lyme literate doctor. So we have a lot of resources on our website for Lyme patients.
Well, I appreciate your time and your insights and just all of the brilliant light that you bring to this confusing disease, Dr. Mafee. And I just want to thank you so much for joining us today. And I hope that you'll be back to visit us sometime in the near future.
Thank you for having me. It was a pleasure.
Okay. Talk to you soon.